Good evening, dear viewers. Once again, we're here for this program, the POLICON, and we are once again blessed to be with our dear guest, Honorable Banyendachi Henry, and our topic of discussion will be looking at the state of health services delivery in Uganda, how best the government can improve health sector that benefits all. Dear viewers, we recall that some studies have been carried out to ascertain the state of health sector in Uganda. And one of the studies which we refer to is entitled Delivering Quality Health Services, a Global Imperative for Universal Health Coverage. But our emphasis, we are looking at the state of health services in Uganda, whether the private health provision and the public. Once again, you're welcome, Honorable Henry Banyendachi. Those who don't know Henry Banyendachi, he is a passionate developmental person who supports very much the achievement or achieving the sustainable development goals. And again, for purpose of reference, personally who know part of your background, especially serving the people of Rwanda West, the first time when you were to be called the development in Tunguka, you were very much keen on supporting, number one, household income improvement. I remember when you were one of the key persons in the Kigezi sub-region who began to support circles, the development of circles. And I remember you invested a lot in that. But most pertinently in our discussion, he's a passionate person that was also interested in the improvement of the health provision. By that time, he constructed a very powerful, magnificent house, and which you ended up surrendering to the people of Rwanda West to come and get services. Right. By that time, for reference, I remember people had stopped to go to Kisoro district where we passed by that very magnificent hospital and saying we can get good services, health services. You were the answer to the cry of the people. And in our discussion today, again, we are privileged to benefit a lot from you when you are a former state minister in the President's Office for Economic Monitoring. Right. In the number of sectors, including the health sector, I believe you're able to analyze and assess where Uganda we are. Honorable, you're welcome once again. The viewers are expecting to hear from you.
Thank you very much for that kind introduction. You have even reminded things that I had forgotten. The passion for uplifting the poor, uplifting them in their well-being, economic-wise and health-wise. And indeed, in 2000, I and Professor Kamuntu, we spearheaded the emergence of microfinance institutions. And by that time, they were being called village banks.
2000?
Yeah, 2000 then. We were visionary, I must say. And at that time, the Bank of Uganda never wanted anybody to call village banks. So we end up with microfinance institutions, which has evolved now into the circles. But it was never easy, and I was so instrumental in all that. And thank you for reminding me on how I dived into the deep waters of health services.
Oh yes, we recall that, we can't forget.
And I formed a non-government organization called Banyendachi Memorial Health Services. Yes, I was still young, that's the same year, 1999. And I transformed the house I had built as a young man then into a health unit. And at that time, people of Rwanda who had never got malaria, and everybody was getting treatment from that facility. And indeed, it's true. Women started delivering from that health unit, and they were not going to Mutorere anymore, which was a distance of about 40 kilometers. So it was amazing what happened. A small intervention helped me understand the problems of the people And at that time, and people gave me votes in 201
2001, yes, I recall.
because of that demonstration I had done.
It was very
with
wonderful.
microfinance, village banks then, and then health sector then. And I competed with Dr. Suruma, Professor Dr. Suruma at that time, who was coming, and that by that time they would say, NRM has chosen this one. And I remember revolutionizing the thinking of the people. I say, when it is voting, you choose the person you want. You are not dictated on the person that is wanted in Kampala by the President Museveni. And people gave me the votes.
Exactly.
So it gave me an insight of what people were suffering in terms of health. And at the end of the day, we had 20 parishes. I had to start a health center in every parish, in all the 20 parishes. And I achieved it. Yes, and I achieved it. And it gave me, these people were really suffering. I would go in a place and you find that somebody would travel more than 20 kilometers to access health services. And this is the problem we are discussing now. The quality of services, the state of healthcare in Uganda. Much as I was doing that and as an individual, it was very, very expensive on my part. I had to sacrifice all my savings. But how many leaders are ready, or members of parliament are ready to sacrifice their savings to give those kind of health units? And besides, is it their job? Is it my job as a member of parliament to build a health center? No. Even as of now, I left when 4 maternity wards and completed because I had that passion. Why should it be a job of a member of parliament to build a maternity ward? How many maternity wards do we have? If you look at my parish, for example, let's say Rwanda district, it has, say, about 40 parishes. Each parish on average has about it has about, on average, it has about 5,000 population. 5,000 population divided by 6, how much do you get? That's about 5,000. So meaning that in each parish, you have about 5,000 active mothers. Okay? Yeah. Even if you say 3,000, 3,000 active mothers. So how can you have 3,000 active ladies without a maternity provision? And no wonder in Uganda, we have 16 women dying per day.
They reduced from 19 to 16 now. At first, they used to refer 19.
Okay, let's take 16.
Okay.
Let's say we have done some improvement. Even if you take 14, even if you take 12, why should a woman die delivering, giving birth? So when an accident happens anywhere, in Rugazi, in Fort Portal, a Horo Kamunye crashes and people die, it becomes a headline. Accident, 16 die in a motor accident. But it is not documented anywhere that 16 women have died today. Today, as we speak now, they are still dying. Maybe as we speak now, they are at 12. 4 are to die during the night. How can we accommodate that kind of situation? That's the kind of state of health we are in. 16 women dying every day, which means for every hour, a woman is dying while giving.
By 2000, between 1999 and 2000, it was higher. The number was higher, mortality rate to 500.
Get on point. So that kind of state of health in Uganda is not acceptable. No woman should die while giving birth, giving life. No woman should die. And we are talking of Women Day. What about children? On every 5 minutes, there's a child who's dying.
Thank you so much.
So when you go at women level, at child mortality, it is the situation is very bad.
Yes, please.
Then, of course, when we go into malaria, why should our people be dying of malaria? A treatable disease. So you find it is as if Ugandans are born to die. By the way,
they are born to live.
When we are talking about this kind of thing, so the actual state of health services in this country, beginning from the national level, the national hospitals, Mulago, Butabika, Chirundu, talk about them. Then you go to referral hospitals, yes, which are regional. Mbarara, Mbale, Kitugum. Then you go to district hospitals. Yes. Then you go to health center 4s. Then you go to health center 3s. Then you go on that primary care. Everything is lacking. And the reason it's lacking is that because we have not committed enough resources into the health sector. Enough resources in terms of building health units which are enough. I've told you I was committing, even as I speak now, they still call me to commit my own resources to go and build a health unit.
There is a unit and
as I speak now, as I was entering, there was a call to contribute towards a health unit by a church organization. Yes. So, as a government, we have even relinquished our duty to take care of the health of the people to the church, to the Catholic Church, Anglican Church, Pentecostal Church, you get? To fill the gap. That's where you have the emergence of the Zambias, the Mengos, what they call non-profit health organizations, which are run by the church
and individuals.
The way we have given up education to these private practitioners and the church, how we have the emergence of Namdiango, the Kisubi, all that kind of stuff. So, as a state, we need to take care of our own people, our own children. We take care right from the day of birth up to your last day. Why should our living, the age, the maximum age one person can average, by average age we should have, why should it be lower? It used to be 45, and now it is at 50, 51, something, 55, you know? So there's a lot to be done in terms of health. And you know, health is not about hospitals only. It's all about many more other things, other facilities. How do we educate our people? How is health education? Because we are talking about quality, we are talking about efficiency. How efficient is it? Ambulance system. You have more, like now, we don't have an ambulance system.
I want to call a bridge by the government concerning ambulances. It is indicated in the manifesto 2011 up to 16, then to 16, I've been very keen that as a policy analyst, and again from 1621, and again I do refer the one of 2021 to 26, the promise of ambulances by each constituency to be having an ambulance to ease directed transport. It has been very keen so much in a way that could solve part of the challenges, apart from even the mortality, high rates, to solve that gap, even including other emerging sicknesses. What do you think? Why is it that this promise, the NRM government, which is having the mandate of the people to fulfill that promise, and it is now overdue, it is not yet fulfilled? During the previous time of COVID-19 crisis, it was evident that some individuals were contributing, donating their funds in order to bridge that gap by buying the vehicles. And other disease vehicles, some of them were used to sort out that challenge. Why has this delayed? In the process of hoping that you were able to, from time to time as a former minister, we are benefiting a lot from you, because being in the docket, especially referred to economic monitoring, we are referring to the health services because we cannot attain the vision as a country, and we here even as a television, Smart 24, to drive business when the state of health among our populace is scaling, because without good health, you cannot make wealth. That is our interest. Why is it that these existing gaps, whether financing and so forth, has been not bridged? And yet, we believe that the NRM government as well, it is interested to see how we can have a prosperous nation, a middle-income earning country, but yet which is not providing some of these basics. What is your take on that, sir?
Pledges trampled over, promises trampled over. Of course, we plead guilty as charged. Plead guilty as charged in the sense that what we pledged, it was not fulfilled. What the government has pledged has not fulfilled. Of course, it defeats anybody's understanding, as I had said, why we don't invest in our health. I was talking about ambulance. You are talking about ambulance system. Every 5 years, when MPs come into Parliament, in the August House, we have now 380, 300 and what?
The MPs ranges to 529.
Rather, 500.
It's a good number.
530.
In Africa, we are having the highest number of MPs.
Of course, yeah. 300, and I was referring 15 years back, 10 years back. 530, each member of parliament is more or less given money equivalent to buy a vehicle. But we do not think and say that can we give every constituency an ambulance. The vehicle grant that we give to a member of parliament, 200 million, would buy an ambulance in every constituency. Okay? No, you say 200, brand new. When we talk on RDCs, every RDC or deputy RDCs is individual RDC has a vehicle. This is also, these are resources that would have invested.
2 RDCs?
Yes. We have not talked about motor vehicles which are being given to, which will end up going to be given to the parish, the sub-county mobilizers. We are now talking about this parish development model. Have we embedded health into the parish development model? Because if you don't have health, you have no wealth. So the issue of saying like in this ambulances is very critical. But man, where are they? Even if when they are bought, they buy a double cabin. How do you expect a mother who's going to be transported for 40 kilometers, being transported in a double cabin, will she reach? Even when we get money and we say we are going for ambulances, we invest it in inappropriate transport system. Then when we buy ambulances, they are another double cabins, they are abused. So we have not really invested where our passion for our people are. To work with one.
Yes, please.
So when we talk about this, we are talking about no ambulance system.
The ambulance system.
No, the hospitals, health units, health center 2s or health center 3s, they are not sufficient. When we are talking about drugs, even those that are there, drugs don't, either they don't reach, or when they reach, they are sold. They are stolen. That's why you are having Murago. You go to Murago, a national referral hospital, but you are being referred to a health, to a pharmaceutical outside the Murago or inside Murago. Only you find that that pharmacy is operated by one of the consultants within the Murago itself. So this is so dangerous because we are talking about this. The whole system is riddled with corruption, which we have talked much more. The drugs are stolen, and you know the system is actually.
One question: you used to monitor.
If I use the word, you know, I don't know.
One question.
I'm here
yes.
to discuss the state. When you say about I used to not to monitor, what did I do? I got defeated. Why did I get defeated? One man, I could not do much as one man.
You could find there other disease.
What do you do? I went in it as a member of parliament for 10 years, member of parliament, for 5 years as a minister. Yes. So as a minister, I don't have that force of law of saying that if I had the powers, if I was to be the president today, I would drastically reduce.
Did you have the powers of directives, making directives?
No, of course I don't. If I had the powers of the president today, I would reduce the expenditure on public administration. I would cut all these RDCs. Yes. I would reduce on the number of MPs.
So that we can have one RDC?
I would. Do you need him anyway?
We don't need it, any RDC.
For what? Okay. You have a chief administrative officer. Huh? You have an LC5.
Those are serious reforms.
Yes. This chief administrative officer represents the central government. The LC5 is the political people's representative. Now, does the president necessarily need another DC to represent him? You already have a chief administrative officer to represent him. So these are these are duplication of activities.
So there should be an amendment to remove
I don't know, but if I was, I would reduce the cost of administration. I would reduce on the cabinet. I would reduce the cost of drastically. The current cost of administration, I would just reduce it even by 70%, maybe 30%. Because you can realize that if we had, now we have 80 ministers around that. Huh? If we had 30 ministers, wouldn't they deliver? Yes. You are talking about 540 members of parliament. Yes. When I was in parliament, we were 315. We were more efficient. That parliament was more efficient than the parliament of today.
But the challenge we had by then time, the approval of those constituencies, the members of parliament.
You see the problem, my brother. Again, our people not understanding, keep on asking. And they think that by having more MPs, you get more service. Having more MPs, there's no service which is added on. You have only increased the administration cost. To some extent, even these districts which have been created, and whereby what used to be a sub-county or a county has turned out to be a district. And in some places, what used to be a sub-county is now a district. So you are having more administration cost centers than more service delivery cost centers. Yeah. So if we were to have these resources diverted into building schools, building hospitals, building roads, providing electricity to every home, giving them sufficient money to help them. Now, when we are talking about this, when we are talking about microfinance funds, and we are talking about giving a parish 100 million, where you are having in this parish, you have 10,000 people. This money is insufficient.
When I made an analysis 2 years ago, 5 years ago, that's 2016, I was assisting one of the political party in coming up with a manifesto. And I'm just making a supplementary analysis to dear viewers. I found out what the Honorable Minister Henry Banyenzachi is talking about is real. Making an amendment to remove the office, the positions of the RDC, the expenditure. We're not targeting people. We are targeting those positions. And
administrative.
Yes, administrative cost. I found out by calculation of the then time before they created more districts that we could save 300 billion per month.
You can imagine.
And
100 billion per month.
And that means every year, that takes us to around 3 trillion. 3 trillion.
In what?
3 trillion in a year saving as administrative cost on RDCs.
3 trillion? No.
We are talking of every year. You
but then
what we calculated down.
I'm
showing that to you. You'll make a calculation during our break. First of all, 1 minute. 1 minute, sir.
Maybe 400 billion.
First of all, they consume. Let me break it down. They consume according to the cost spent on them, every month. They are given 1,000 liters to enable them monitor. Every month, 1,000 liters for the office of the RDC. The vehicle which they use, it is between a cost of 70 to 100 million. Others 150. Those double cabins.
Okay, just the point you are making, Let's not go, when we go into calculation, in the interest of time. Of course, it can't be 3 trillion. It may be a very on the higher side. But of course, when you see how much we pay, when I was in Parliament, when I was still in Parliament, I used to say that when you see a minister on the road, it is a hospital moving. Because now, like for example, a car that a minister drives every 5 years, they change a car. If it is this in Pencon, it's 500 million. So 500 million, this is a full-fledged health unit. So when you say a minister, it is a hospital running. And remember, these days they even have lead cars. Some even they have backup cars.
It's for their security.
No. For the security, what about the security of the people? Why should you make yourself that kind of insecure? Are they insecure against their people?
And
why should I be a minister if I'm going to my constituents? Why should I go with a full vehicle?
Even MPs, they are giving them the security guards.
Why should I go with a car full of security guards? I'm a minister. I'm going to my constituents. Why should I go with a car full of security guards? Whom am I guarding myself from where? From the people I lead? If I'm going to West Nile.
You know, we had the incidents of the death of the Abiriga, Honorable Abiriga.
Forget about that. How many
and
citizens?
The other time there was also an attempt to kill Honorable.
How many citizens have? How many citizens have?
Katumba Wamala. So there is
excuse me. How many citizens have been crowbared? How many border are crowbared per day? Should we give an escort to every border because they are crowbering border? Does the life of a member of parliament, is it more precious than the life of a border?
All of them are important, but
security is important. What are you talking about? So should an MP have security and the border should not get security? So the most important is to give a holistic, secure the whole country. Give an enabling environment that will secure the whole country. And if you are giving this security, invest in the people. Let the people be secure, they will secure you. But the moment you don't invest in the people and the people feel insecure, then you are also insecure. Give jobs to the youth. They will not demonstrate. They will not steal. They will be printed. You go to countries like, some countries like, you go like to countries like Dubai. Even if you leave your vehicle open, nobody will enter it. Even if you leave your laptop in a vehicle, nobody will enter it. Because even the moral degeneration, okay? So, but because these young boys who are riding border, you know what? The insecurity stems from unemployment.
Yes.
It stems from lack of incomes.
Okay.
It stems from moral degeneration, poor education. So, in all these things that we are talking about.
Thank you. Our topic remains the state of health services delivery in Uganda. And dear viewers, back again to remind you, Smart 24 is the best TV that can give you such information. And we are looking at how best the government can improve health sector that benefits all. There are, for purpose of our discussion, there are a number of initiatives, programs that the government had for the previous years, which were implemented by the government, and which we do give a credit as a country and citizens. We refer to immunization and the statistics, which refer before the coming of NRM into power for the last 35 years. It is quite promising compared with some other developing countries which might have not achieved these targets. And we also, of course, appreciate the World Health Organization, which has given such backup support. We also remember that from time to time, the vaccination of some killer diseases, including some which emerged during the last 10 years, Marburg and so forth, then of the recent COVID-19, and up to where we are, a number of achievements. On the other hand, much as we are having challenges, we take note as per the current state of record and data that a lot has been done. And again, for purpose of guiding our discussion, we also look at the World Health Organization was so keen to undertake a study that was entitled Delivering Quality Health Services. It is a global imperative for universal health coverage, which is not only targeting Uganda either for any criticism, but which intends to guide how countries should promote good health. Our dear guests allow me to outline these 4 main targets that were referred to be key targets that are particularly for low and middle income countries. And the following examples were given. 1, that there should be adherence to clinical practice guidelines in 8 low and middle income countries. And by that time it was found that 50% in several instances was resulting into low quality internetal and child care and deficiency family planning. Again, another focus, according to the study, it referred the service delivery indicators initiative in 7 low and middle income countries show significant variation in the provider absenteeism. Those who go for providing health services, the workforce, it was found out that there was high level of absenteeism. And again, a systematic review which was also made reveals that 80 studies showed that suboptimal clinical practice in both private and public primary health care facilities was found in low and middle income countries. Then last but not least, it was revealed by the Economic Cooperation and Development data that high and middle income countries show that 19 to 53 of women aged 50 to 69 years did not receive the mammography screening, and 27 to 73 of older adults aged 65 years and above did not receive influenza vaccination. A number of these programs that have come on board, including this is the last point I've mentioned, COVID-19, it is believed even out of the 45, the 17 million adults, but the rate of vaccination even against COVID-19 seems not to have so far captured what would have been targeted. And yet, the target of the government is to have a healthy and a sustainable healthy population. Honorable, with this study, in 2 minutes as we go for a break, what exactly remains a serious cause of this gap, unable to fulfill the intended program targets, which is the universal primary health care? We'll continue from there. Just in
of course, when you talk
minutes.
about absenteeism, you are talking about the efficiency of how doctors or health workers attend to their patients. Mm-hmm. When you look at what is pertains today, the pay is so that they are demotivated at that times. When you're talking about these other tests like that, what you're talking about, mammography services,
screening,
X-ray services, those MRIs, some of these services that they are talking about, you can only access them in one place, in a whole region, in one hospital. When you're in Western Uganda, you go to Mbarara. When you go or come to Murago, and at a very high cost, even in the government hospitals. So you find that the equity, the poor cannot get the services because they don't have the money. The timeliness, they cannot get the services.
So good health is for that rich.
Yes.
Health is for the rich.
So you find that it is a bit good health becomes for the rich because the people cannot manage. And then you find our people, they are left fat. So most of these things you find that the effectiveness, the availability, the closeness to the health centers. So the issue is pathetic. So therefore,
yes, please, as you conclude,
we need to invest more.
yes.
We need to put more, we need to invest more, we need to pay our doctors better. We don't need to have administrators being paid 10 times more than a doctor.
Thank you.
An MP is paid 10 times, just senior 6 equivalent is paid 10 times than a doctor who have studied.
Honorable, allow us to stop
For
at
15
that.
years, for 20 years in his.
We will continue from that in the next hour. Please stay on with Smart 24. That's where you can get the best information. See you in the next session.